Alrighty. Hello and welcome, Sue. How are things going today?
Things are going well, Dr. Klopp. Thank you.
Yes, very nice to have you here, and I appreciate you taking out the time to hang out and talk a little bit about your wonderful son. If you don't mind, just give us a little bit of a background as to sort of early life for him. What was leading up to his autism diagnosis, and some of the things that you did in those early days.
Sure. So Sean was born July of 2016, so he's a little bit older than a little bit over 4. He was born natural birth, 7 pounds 20 ounces, perfect APGAR score. It was either a 9 or a 10. He was developing very well, and around the time he was about 12 to 18 months, we noticed there was a little bit of delay with his crawling and walking and things like that. And we just noticed more red flags. He started regressing a little bit in his speech. And I can't pinpoint one situation where this really happened, but I feel personally as a parent, just from watching him, I think it was a combination of antibiotics, Miralax, and vaccines, if I can say that. He started having gut issues, which he didn't have when he was mainly breastfed. He started having gut issues around 12 to 18 months, and we introduced dairy at that time, so he wouldn't have bowel movements but once every 4 or 5 days. And when he did, he would have encroposis, which is just huge bowel movements that would just run out of his diaper. So we knew there was something going on. And then my wife, Purvi, she took him to get tested for speech because he was a little bit delayed in speech. And we took him to the pediatrician. And she's like, we're saying his name and he's not responding to his name. So she's like, well, you could maybe wait to see what happens. And my wife is very proactive, so she took him immediately for a speech evaluation. And he was 1 percentile for receptive and expressive speech. And he had these weird behaviors. He left a birthday party one time for a 2-year-old, and basically he just went to the parking lot and he just started touching like 50 license plates. Or he would just like kind of walk around our car when we used to go to the park instead of actually playing in the park. Or he would just like put a bunch of wooden barks on the slide sometimes. Sometimes he would do it appropriately, sometimes not. So even with a dental background, I never myself suspected autism. So we actually took him and got him officially diagnosed at 21 months. And Purvi actually took him. And when I found out, I was obviously kind of, heartbroken. I didn't really realize how complex autism was. And then I started reading about it online, and then I started joining more groups. And then honestly, I just became a little bit obsessed about it. How can I help him? How can I recover him? How can I, change his behaviors? What can I do to increase his speech? How can I improve his GI issues? So we took him to a MAPS doctor and got him tested for all these things. And he started to start developing a little bit of speech. We started giving some vitamin D drops. He started the Nemechek protocol from Patrick Nemechek, which is very popular globally, and he responded pretty well to the inulin, quarter teaspoon, the fish oil, olive oil, and he started having more, I would say, more regular movements, bowel movements. And then also, I started him after doing that Nemechek for about 6 months. I noticed that he started getting a little bit more speech and a little bit more eye contact, and I said, wow, his GI, as soon as his GI symptoms started improving a little bit, I've noticed that his autism symptoms have started to subside a little bit. And then I started him on TRS, which I felt was a little bit easier for us because we did get tested and he had a lot of heavy metal toxins, mercury, and a lot of other things, 99 percentile. So I've been doing a spray of TRS since he was about, I would say about 30 months. And he's about, so almost about less than 2 years, one spray. And also I've been doing the ANRC Essentials, which is the powder that Dr. Adams recommended.
Right.
So I still noticed he still had some undigested food in his stool, and I still noticed that he just didn't have normal bowel movements. And then I started reading more, and then through FMT groups, I saw one of your videos, and I was fascinated. I started looking for these options because I actually personally called Dr. Adams and told him. He said, "Well, you can list him for one of the clinical trials, but they don't take children until the age of 5. And Sean was 3.5, and I wanted to do as much as I can because all the recovery stories I've read, the children usually do better in general when they have a lot of biomedical and ABA and all these treatments between the age of 2 and 5. Not to say that older parents can't do it. I don't want anyone to lose hope because I've seen older parents. I've seen parents do it for the older children as well.
Right.
So we went. A little bit of background. I exchanged lots and lots of messages and texts and emails and things with you, and it took me a good 3 months to convince my wife to take Sean, and also convince my brother, who's an ENT surgeon. He's very intelligent. He has a Western medical background, but so I actually gave him a presentation about Dr. Adams' study and all the different things that FMT can help for, and a little bit about the donors that you guys have chosen and the research I've done that you shared with me about non-vaccinated and, their diet, minimal antibiotics, all that stuff, age. And then I showed them their blood report, stool report, all these things. So luckily, thank God, they both agreed, and we got to take Sean to Rosarito in January, which spent a little bit over 10 months. Some of the other backgrounds for some of his issues, he had 3 bands of Lyme disease when we took him for,
Right.
So he was coughing literally 2 to 3 hours every day, summer coughing, nighttime coughing. He would run out of his room at 2 or 3 a.m. and run into our bed. Then I'd have to walk him back in, and he'd run out back 10, 15 minutes later back in our room. And it was really tough because we were actually trying to get pregnant, with our second one at the time. So actually when we went to Rosarito, Purvi was pregnant. Now we have a baby girl that was born in May.
Yes.
So so we took him to Rosarito, and the first couple of months, January, I would say we went in mid-Jan until March, he would have some of his old episodic behaviors, some physical aggression, some hyperactivity, lack of attention, lack of focus, just inconsistent behaviors.
Right.
And as time went by, I noticed that his speech started just getting clearer, better. His cough completely went away. I don't know exactly when that was, but it was sometime in the March. And Purvi's like, well, let's see what happens. Sometimes he doesn't cough until summer, this and that. And knock on wood, he hasn't really coughed in the last 10 months. He has really good eye contact now. He is currently, his expressive speech is a 5.5-year-old, and his receptive speech is a 4.5-year-old, and he's 4.3.
Wow.
So he can ride a bike now. He was fully potty trained a little bit, I think, before we went to Rosarito, but now it's just like everything is done without any prompts. Wiping, the whole shebang. He does everything by himself. He can walk downstairs like a spiral staircase, alternating legs. So his fine motor skills, his gross motor skills have improved tremendously. He can jump into a swimming pool as far as he can go with his cousins. So he can go further without any type of anxiety.
Right.
He sleeps with no anxiety. He's had daily bowel movements literally since we came back, except for maybe the first week. It was a little bit back and forth with the changes. So he's just constantly improving, and he's still improving more and more. So he's doing Zoom meetings at school, and he's indistinguishable. I mean, his ATEC score when he was diagnosed with 72, back when he was diagnosed at 21 months, and then when I tested him right before we went to Rosarito, it was at 32, and I recently tested him here around Halloween time, and it was a 4.
Wow.
Just a little bit of perseveration and a little bossy. I don't know exactly how you score him, but what 4-year-old's not bossy, right?
Yeah,
So,
I would say that's pretty typical.
yeah,
I have a
exactly.
4-year-old too.
So I'm not too concerned about that. Food restrictions, he eats unprompted. He'll eat everything. He'll bite into sandwiches. Before, he would just barely kind of nibble them. I mean, like whatever food that we pack it for him at school, he would just eat it all.
Wow.
It would all come back, and no restrictions. He never really had a lot of allergies and tons of food restrictions, but everything has been enhanced and improved since we actually went. And we haven't changed anything since we went, except for doing the FMT. He's still doing the, one thing actually we did change, we stopped doing inulin in March.
Right.
I weaned it off from a quarter teaspoon to an eighth and a 16 to eventually till he's not on it. But I still consistently do. I one spray of the TRS. I know that's a little bit of back and forth. That's antimicrobial, this and that. But I just made the daddy gut decision to do that, and it's worked out well. And he's still doing the ANRC essentials, and his numbers have gone up. He recently got some blood work. His vitamin B12 numbers have gone up. His vitamin D numbers have gone up. So he has a best friend.
Digesting and absorbing properly.
Yeah, testing, absorbing property, just normal looking bowel movements, except for, maybe a little bit of constipation once in a great while, or maybe a little bit running stool, stuff that I feel like the general population, we all get here and there, depending on his diet or spicy foods or this like that.
Right.
So he has a best friend that he plays with, and he had one, but now he plays perfectly with him, and he'll meet new kids at the park, and then the moms will call Pervy and say, hey, my kids like Sean, they want to play with him again. And
oh, that's great.
As a parent with a child with autism, all these things, me being an emotional guy and very, very personal and very passionate about all the things I do, whether it's, my profession or trying to help Sean, you just can't help but, hold back the tears when you hear like, wow, these kids want to play with Sean.
Wow.
So
wow. And for you, I mean, as you described this, I think a lot of what you described is just very early on, as soon as you recognize things weren't going the way that you had hoped, he wasn't reaching some of his developmental milestones, his speech milestones, and you just got very, very proactive. Could you describe like what your biggest concerns were in those early days, looking at what it all involved autism and what your sort of projection of the next 5 or 10 years might have looked like?
yes, he had fleeting eye contact. He was constantly coughing and sneezing, and he was using a nebulizer literally almost every week at the nurse when he was at elementary school. I don't even know where I put the nebulizer now. I haven't had to use it since we came back from Mexico in Jan. Those are some of the things, like sleeping at night, anxiety, having to lay down with him before he went to bed. I was like, wow, his handwriting just like took off too. It's like he couldn't really write. If you see him read now, he reads like I don't know how he reads like a second grader.
Wow.
Like he will just read really fast, and he still has a little bit of work with comprehension. He's 4, but in general, like he can read 3-4 syllable words. He knows 150 world capitals. He knows all the capitals of Asia and Africa. Which is, I had to learn it myself.
I don't even know most of them, so.
I had to learn this, but I have to keep relearning them. Once he learns them, he never forgets them. I have to like recheck up on him once a week. He actually did a 500-piece animal puzzle all by himself. I did not put one piece on the puzzle. I just kind of was watching him. He said, Dad, hey, come look, I did a piece. And then later on, he would just do the pieces without saying anything. And then he was all done. He could just pick up a piece and tell you when it went. There's like a pile of 100 pieces. So he's got some of these, this autism superpower stuff going on, which is really neat to watch.
Right.
So my biggest concern for him was his GI, his GI issues. I was like, without having normal bowel movements, it's really, obviously we all know about the gut-brain connection. I mean, without having normal bowel movements, it's going to affect his sleep. So I was always worried about anxiety. What's he going to be like when he's older? Is he going to have friends? All these little things. And, some of the concerns of my wife is like, well, he's pretty high functioning already. I was like, well, these are the kids I think that can really benefit from, when I was trying to convince her that can really benefit is the ones that are Asperger's or high functioning. I mean, not all the kids can benefit. We've seen, I've talked to some of the moms that went on their treatment, some of them, that their kids were severe and they've almost lost their diagnosis. So miracles do happen. But so I was like, he's close, but kids that are close, they just need that extra push.
Right. And I mean, if you think too you did a lot of great work, right? I think you mentioned the ATEC went from 70 to
32.
40. Yeah. So,
that included 40 hours of ABA, chiropractic massages, equine therapy, aquatic therapy. So the wife was doing all the therapies, and I was doing the biomedical therapy. So we kind of, worked on each other's strengths and communicated well on that in that sense.
Right.
And
And so you'd made a lot of progress over, a period of time. How long would that have been then? So from 20, 21 months to 3.5?
yes, so a lot of 3.5 is what, about 42 months, literally 21 months. It took us that long to slowly get that score down where we got it down significantly. So if, being a numbers guy, if I had to extrapolate, I think his ATEC score would be still in the low to mid 30s because most of his points were from health,
Right,
GI issues, coughing, and things like that. And that's a quarter of the ATEC scoring.
right,
And the other points I think would kind of come a little bit from, I don't think he would have improved so much in his gross motor skills, fine motor skills, and all these things without the FMT. Crossing the midline, riding his bike at a 5.0, 6.0 level with no fear. It's
right,
like, I was like, I still remember some mom saying, well, you better, you better run fast. He's going really fast. And she said, well, I said, well, he's almost 4. He's not even 4 yet. And the mom couldn't believe it. Obviously, she didn't know that he was on the spectrum. So,
right,
well, like, she thinks he's awesome for a neurotypical kid. All these
right.
little things just make me like, the happiest dad in the world.
That's really phenomenal. And I think your experience is similar to many other parents. And maybe you can just speak to this a little bit about having to encourage, I don't know if the word convince is the right word, but to encourage your other family members to kind of come on board with this idea. What did you find in that process was the most helpful? Was it just being patient, presenting all the information? What did you find there was critical?
Well, honestly, it was getting a little frustrating for me because they want to see all these results, how many patients, you started your retreats in July, August. They wanted to see, people treat like 300 kids. They're like, well, the first group that went with Dr. Adams, I told them they didn't have anyone. And
Right,
I told them, look, in my opinion, I'm a dentist, but in my opinion, all the research in 10 to 20 years, FMT is going to be standard of care for a lot of autoimmune diseases, but we don't have that time. Uh, you know, the so that was one of the things that I really had to work on. I had to like pull testimonials from other moms that have gone before, that have had good experiences, and you know, almost all of them had some gains, whether it's GI movement, and some of them had lots of gains, massive gains. Some of them had mild to moderate, but it's only been a month or two. I mean, a
right,
lot of times these, as we've seen and read, through the groups and the first 2 3 months, I told him like he could get back some of his older behaviors, and then before he starts getting better, while his body's getting used to, we use the die off and things like that. So
right,
there's a few pretty heated conversations, but and I'm a pretty easygoing pushover kind of guy, but I was relentless. There's no way I was not going to look at myself in the mirror and not try this for him, because I knew the science backed it up. I knew what the numbers were, even with Dr. Adams' small clinical trial. What made me more impressed is like yours is like 2 days of enema, when Dr. Adams, is nothing to take away from him. I think the world of him as well. Yours is 2 days of enema. Dr. Adams is 1 day of enema, and yours is a 16-week home, liquid dose or pill dose, where he was doing 8 weeks. So I just felt like, what? I feel like Dr. Klopp is going above and beyond just to ensure what he's doing, just, because the whole world and eyes are on him. So he's very diligent, he's a perfectionist. And just our phone conversation with you, spending an hour with us on a weekday with 3 kids under 5, like, wow, that's passion. And that's how I practice, dentistry myself, with a lot of passion. So, so finally they both agreed. My brother had, I told my brother, look, you got to, so he kind of helped convince her, because him being the MD, and, just, so I urge, anyone who's wanting to do it and having a hard time convincing their spouse, to literally get testimonials from other parents, work together, do research about Dr. Adams, just kind of get all this stuff. Because I know there's a lot of parents that are like, in general, it's usually my husband doesn't want to do it. The moms want to do it because they're with the kids all the time. For us,
right,
it's kind of a reversal role, but luckily it worked out for us.
Right, right. Yeah, I remember those days, and you were one of the more persistent people that I've met. So you might want to lose that identity of pushover dad, because you were bowling right forward. And honestly, it's been such a joy and pleasure to work with you from the very beginning until now. I love that you send me, little video and picture updates and progress updates. It really, reminds me of why I'm doing this, and it keeps that sort of fire and passion alive. So I really, really appreciate that. And I know you got to get going back to work, but is there anything? I mean, I think you kind of said it all, but any last message that you'd like to leave with other parents who might be watching this?
Yes, it's basically, there's things in life that, all the parents are worried about the unknown. Is my child, the question that they ask, is my child going to regress? Is my child going to do this and that? Every parent is going to do what they feel is best for their child, what can help their child. And what I like about your FMT and things is the FMT retreat attendee group, the Zoom meetings. There's many, many parents that have gone that are very passionate to help their kids. They're always available to answer questions and things like that. So I feel like one thing that I love about what you do, as opposed to whether someone goes to Panama for cells or this place or that place, is like there's a support group, there's a team. People always trying to help, and trying to improve. So, kudos to you for that, Dr. Klopp, because I know being busy with 3 younger kids and trying to coordinate all this stuff with COVID and when parents want to go and all these other places. So I really love and appreciate the passion that you have for what you do, and that's another thing that kind of gets me motivated every day.
Well, that's
So
wonderful.
thank you again, for everything you've done for Sean. And if any parent has any questions further for me, you're very they can share my contact information. As you know, I'm pretty active on Facebook, and I love to help anyone else who I can.
Well, that's wonderful. And thanks so much again, and have a great rest of your day.
You too, Dr. Klopp. Thank you, sir.